Welcome to The Other Side, Mississippi Today's podcast. We cover politics and issues that affect Mississippians, public policy issues. I'm Bobby Harrison, your host this week, and I'm here today with my colleague and good friend, Sophia.
Hey, Bobby.
Hey, Paffenroth.
Mm-hmm. Yep.
Excuse me, I'm from Jones County. So, and Sophia is a member of our talented health reporting team. So, and she's going to lead the conversation today with our guest. Our guest today, we're lucky to have with us second-term State House member Dana McLean from the Lowndes County, Columbus area. Welcome to the podcast.
Thank you.
And we invited you to talk primarily about the rape kit legislation you introduced this session. And
right.
You know, as I was reading Sophia's excellent stories from that legislation, I just assumed that when the issue came up about whether with rape kits, what your legislation does is trying to ensure that they're performed in a timely manner. And I just assumed that happened, but just routinely, but apparently it doesn't.
Not just necessarily in a timely manner, but to treat them and perform a rape kit, period.
Oh.
Sometimes victims present to hospitals and they're told, we either don't have a rape kit here, we don't do that here, there's another place you need to go, or you need to go to another hospital. So that was the purpose of the legislation.
Yeah, it's amazing that that in 2025 we're talking about this in a sense.
Yeah.
Mm-hmm.
Yeah.
Well, it is a shame that it's something that we have to legislate, but when you start hearing stories and you realize that there are victims out there that have been turned away, you know, that's part of my job.
Mm-hmm. And you said before that this would really just be enshrining in law what hospitals are already supposed to be doing.
Right.
So it wouldn't be, for example, like an additional staffing mandate. Is that correct?
No, that's right.
Mm-hmm.
That's right. Any nurse, even an LPN, is capable of performing a rape kit. There are instructions on the kit, very detailed instructions. There's also a number on the kit, and that is to link to one of the SANE certified nurses in the Jackson area. And SANE is SANE, and that's Sexual Assault Nurse Examiner. And so the number is there to be able to walk someone through that if they need additional instruction. And so we're providing as much assistance as we possibly can.
Yeah, that's terrific. And so this would really just be codifying essentially what hospitals are expected to do.
Correct.
And you said that there are 3 parts to this. Can you go over the 3 parts?
Sure. First, it's requiring hospitals to have a supply of rape kits. It's very easy for them to have that. They should all have a supply because, as we've heard, some hospitals don't have a kit, and so that's why they turn someone away. The second mandate is that they have someone there who's capable of performing a rape kit. And in the bill, it states could be a physician, an RN, an LPN, as physician's assistant. So someone there who would already be on staff. If you're an ER and you're open for business, you have one of those staff members there that can actually perform the kit. The third mandate is that no victim ever be turned away from an emergency room hospital.
And can you talk a little bit about the inspiration behind the bill? So you were approached, you heard about several victims who had been turned away from
That's
ERs.
correct.
Yeah.
Yes. I've heard several stories. They've been verified. We actually had a story recently in North Mississippi in January of this year. So while we were in session, it happened while we were in session after I had already dropped the bill, and where there was a human trafficking, sexual assault victim that escaped. Her attacker was taken by law enforcement to a hospital, and the hospital said, we don't do that here. You need to go to another place. She went to another place and another ER, and after 8 hours was told, well, we don't have a rape kit.
Is this something that you considered before, or was this a complete surprise that this wasn't happening in hospitals here in the state?
It was a surprise to me.
Yeah, I imagine.
It's something that you would expect is happening. It is happening, and it is happening not just in North Mississippi. It's happening in South Mississippi. It's happening in rural areas. In the Jackson area, not so much, because we have the Center for Violence Prevention, and they have their own SANE certified nurses, and they have MOUs with the hospitals here in the Jackson area. So when a victim presents, they call the number, and a SANE nurse is sent to treat and examine and perform the rape kit on the victim.
Yeah, which is wonderful, but the rest of the state, right?
That's right.
Doesn't have that privilege.
That's right.
Yeah.
But can a hospital emergency room in another part of the state, they can call that number and get someone to just kind of walk them through?
Sure.
Yeah.
Yes.
Yeah.
Yes.
You said, yeah.
Right. And if you're a nurse, you have had the training to be able to take a swab. During COVID, we had the COVID test, and you were putting a swab in your nose to test for COVID. So these nurses would be able to perform the rape kit.
Sure. Yeah. And so your original bill that you authored did die in the Senate.
Yes,
but
it
then
did.
you revived the legislation. It's currently alive and well and moving through the legislature. Are you hopeful?
I am hopeful. It was added to Senate Bill 2211, which is a bill that adds additional rights to the Crime Victims Bill of Rights that we have here in Mississippi. And this language, so now it's a Judiciary B bill instead of a public health bill, which was our bill originally. Went through Public Health Committee in the House, passed unanimously in the House, was sent over to the Senate, and didn't come out of committee there.
Okay.
So I amended the Senate bill that had come to us, 2211, and added the language from House Bill 928.
You're in your second term, as I mentioned. Did you learn quickly how? I mean, it's hard to pass legislation. I mean, there's so many different nooks and crannies, and sort of just like a jigsaw puzzle sometimes.
Right.
Even though the legislation, the simplest legislation, you think this is common sense legislation, there's always so many details to work out. But you passed some significant legislation, I think, last year, and then you're on the verge of soon passing this legislation.
Right.
I guess you're learning it, but as you're learning, you're getting things done.
Well, thank you, Bobby. It is hard to have a bill passed. I mean, as we know, 80-90% don't make it through. So, last year I had a bill that I had worked on and dropped for 5 years and finally passed through. So I do understand. But for this type of legislation, if we wait another year, just think of the victims that may not be able to get justice.
It impacts one person. That's too many.
Absolutely.
Yeah.
Because, first we have to have the evidence in order to prosecute. So if we don't have a rape kit, we don't have the evidence, and that person is free to offend again. And then the victim is not able to get justice. And so I think about a victim that has gone through a horrific rape or sexual attack and then presents to an ER and is told, "I'm sorry, we can't help you." Just think how defeated and traumatized this person is again.
There's been a lot of outspoken support from, for example, Attorney General Lynn Fitch and others.
Right.
Does it feel like there's a lot of momentum?
Well, I feel like there has been momentum. We did have the press conference.
Sure.
We had law enforcement that came out in significant numbers to support us. We had many legislators that supported us from the House and the Senate, and then victims advocates that were there in support, and then, of course, the Attorney General's office. So I do feel like there has been momentum. But when things go to conference, which is where the bill is headed, you never know what's going to happen.
Watching this from afar, not nearly as acquainted with the issues as you and Sophia are, it appears that early on the hospital association and some hospitals had some issues, but now it seems like they're willing to come to the table to discuss those issues and to hopefully work them out. Is that a fair assumption?
Well, we collaborated with the Mississippi Hospital Association from the get-go. We met with them in the fall, talked with them about the legislation, talked with them about the issues that we were hearing, and they wanted to collaborate with us. We met again with them, with the director of the Mississippi Hospital Association in January. They have had a seat at the table and said they would not oppose our bill. That's all I know. I do know that they have brought forth some legislation, some language in that they wanted in the legislation, and I don't believe that language really does much of anything. So,
so you're okay with that, with the language?
No, I don't think it really protects victims.
Oh, okay.
Yeah,
Okay.
I don't think it does much.
So that would be the issue that still has to be worked out in conference. And,
Right.
Yeah.
Right.
Could not to get too much into the machinations of the Mississippi legislature, but where the bill is in the process, could the Senate just pass it and send it on to the governor without going to?
Well, they could have. They could have concurred, but they didn't.
They did invite conference.
Right. They did
Okay.
invite conference. So that's where it will be.
Okay. And the conferees haven't been named yet, I don't believe.
I expect to be a conferee from the House side.
Sure.
I don't believe the Senate has named their conferees yet.
Okay. And in the past, you've also authored legislation for sexual assault survivors. Back in 2023, you authored some legislation to streamline the rape kit processing timeline.
Right.
Do you have any concept of how that's going or how this builds on that?
Well, there was a task force that was put into place as a result of this 2023
That's right.
legislation.
That's right, yeah.
So I did follow the task force committee meetings, and I think a lot of the gaps were filled in. The purpose of the study committee was to see what additional legislation would need to be passed in the future. And I think the task force did a wonderful job as far as, we found a vendor that can actually track the rape kits and have a barcode and a website where victims can actually confidentially log on and find out where their rape kit is in the process.
Oh, that's amazing.
Right. So I think, and this legislation also does build upon that 2023 legislation. I feel like that it's kind of a continual thing. When we find problems, that's when we have to, put out legislation to correct those problems.
Sure. And does that task force still exist? Are they still working
No,
together?
they are not.
Okay, they
Yes.
were really just created to sort of
Right, exactly.
get things off the
Right.
ground. Okay.
And what we would like to do, and I did drop a bill, but it didn't make it through, but it was regarding reporting requirements to have, so we would be able to know when a victim presents to an hospital or presents to law enforcement, that we would actually get reports and find out dates, how many kits have been performed, so that way we can better have an idea of what's going on out there.
Would that be a Department of Health? Would that be through some type of law enforcement
Or
agency?
DPS, yeah.
Right, through
Okay.
DPS would, but then the legislation that I authored would actually, it would provide those reports to the Attorney General's office.
Okay.
And then they would collect the information and the data and be able to either report that data or send a report to legislators or have it public on a website. So we're still kind of working the kinks out on that, and I hope to be able to drop something similar next session.
Back to the earlier question about how legislation takes.
There you go.
Yeah, jumping ahead. I mean, we're getting close to the end of the session. What other big issues are you see out there that you're interested in? Throw you a curveball there. I'm
Yeah,
sorry.
no, that's okay. Well, I also have been working on legislation to certify midwives. Sophia has done a piece on that.
That's right.
And I think it's something that we really need to have happen. My bill actually didn't make it through the Senate Public Health Committee. It did make it through the House. But there are community midwives, lay midwives, direct entry midwives. They have a lot of different names that are out in the communities. We have around 200 of these midwives throughout the state, and they are delivering babies. And Mississippi has no oversight whatsoever on these midwives. And most of the midwives, especially the really good ones, want certification and licensure. They want us to legitimize the practice of midwifery, and they feel like that other midwives will maybe move to the state and set up practice. But, we have licensure for a lot of other different types of healthcare, or say music therapist. I did amend the music therapy bill that came over to us from the Senate, and added as an amendment on the floor the midwifery certification.
I see.
Right.
Okay, so is that currently still alive, but you're thinking it won't make it?
It is, and it is going to conference.
Okay.
But I've been told that the midwifery language will not make it through to the
Sure.
end.
Okay.
So that will be something that I'll work on next session.
Well, wouldn't it give them some? You talked. They want the legislation. It would give them some protection. It seems to kind of make it more of a, some guidelines and stuff.
Sure.
Yeah.
Yes, it would. And it would establish a board, a 9-member board. And Dr. Edney said it would be good that if we would have the state health officer as one of the members of the board. He indicated he feels that it's a safety issue.
Right.
And so do I. You or I, Bobby, could set up a Facebook page and say, we are midwives, and we could go out and start catching babies.
Well, you'd probably get a lot of business, but I'm not going to get any business.
But that's the problem.
Yeah.
Right.
Anyone with zero training can say that they're a midwife, and nobody would fight that. So we do need oversight.
And do you have any idea what the real opposition is? I mean, I've heard from senators that they just don't want to endorse midwifery, but I mean, it already exists, right? Like not passing the legislation is not preventing midwives from practicing.
No, it's not at all.
Right.
I don't know what the legitimate
Sure.
Opposition would be to this.
Sure.
Because it's protecting moms and it's protecting babies. And as we know, we have maternal health care is just, it's sometimes non-existent in certain areas of the state, especially rural areas.
Yeah.
And we know that over 50% of our 82 counties are maternal health care deserts. And this could fill that gap with midwifery. So I think it's something that we really need to think about. And I have dropped this legislation. I believe this was my 3rd year. So once again, I'll go again.
Right.
I'll get up to bat again. So,
Representative McLean, are there any issues, any questions that you feel we haven't asked you that we should ask to conclude this interview, or are we in good shape?
No, I think we're in good shape. Don't ask me anything about the tax bill, okay?
Well, as we record this, I think the tax bill is still a sort of a moving target.
It is.
So
a lot of moving parts in that too.
So
Right.
we'll wait on that for a few days. Thanks for your time, Sophia.
Yeah,
thanks for
thank
doing
you
this
so
with
much.
me, and
Thank you.
thanks for everybody listening to another episode of the Other Side Podcast.